Assalamu alaikum my friends, good morning, welcome back to another video. This video is gonna be interesting because we are gonna discuss some ethical scenarios for pre-med students that have been designed by a very experienced doctor who has taken several mock interviews, Dr. Sana Rashid, an alumni of my alma mater and a very good friend. She has designed 8 cases that can be used for pre-med students to practice for their interviews at different renowned med schools. The cases that we're gonna discuss today are formulated in the way of multiple mini interviews. And what happens in those interviews is that you go for the interviews and there are different stations, essentially 5 or 6 stations, and you have like 6 minutes at every station and you need to go. They'll give you a scenario, you have to read through that scenario and then your time starts and you need to go in. You'll probably have a role play inside, or maybe you just have to go and discuss it with the interviewer and you'll tell them what your thoughts are in that given time period. And then they will mark you and they will see if you're fit for whatever you're applying for. So that is how it happens. Going on with the cases now. We're going to discuss the case and we're going to see how we should handle it. So the first case, I'm going to read the first case and you'll see that case on your screen. The first case, a 14-year-old boy was brought in by EMS after being found unresponsive at his home by his mother. EMS was able to restore spontaneous circulation after 45 minutes of CPR, after which the boy was placed on a ventilator. After completing your assessment of the patient, you conclude that the patient is brain dead and must be taken off the ventilator. The mother is waiting for you inside. So in this case, you eventually have to go inside the room and you have to tell the mother how her son is brain dead and how he has to be taken off the ventilator. This is a tough job, and basically this is the worst news you can give to a mother. Here is some procedure that you may want to follow. First of all, you'll go in, you'll ask if she is the mother of so and so child. You'll introduce yourself to her. For example, I'm Dr. Abdullah and I'm from this in this department and I have been the doctor to your son. Take his name. And then you'll go on and tell her that you have a bad news and you want her to please sit down or so that you may share the news with her, and you can even ask her to call someone. Once you've given this small indicator of what's coming up, you should not wait long enough and you should just get to the point. So you tell her that we unfortunately have tried everything we could, but your son could not make it and currently we had to put him on a ventilator. And I'm really sorry to tell you, but he is brain dead. Now, most often what happens is that patients and relatives of patients are unable to process the fact that a patient is brain dead, but is on a machine and the heart is beating and everything's going perfectly. So how can he or she be dead? And that is where you step in, and that is where you're basically tested how you have to convince the mother that her son is basically not in this world right now. And it's the machines that are working for him and not the body itself, right? And then you have to eventually convince her. You can resolve either way. You can either go on with the fact that I'll call someone else or give you some time to manage and we'll talk about it later. It's up to you, the decision is yours. Or if there are some cases where the mothers and the parents basically are they easily understand and they comply, which is very rare because they have to go through such an emotional breakdown. It's really difficult, but if they do, that's good for you. But since these are scenarios for an interview, they are bound to be difficult. So moving on towards the next case. Your best friend has recently gone through a bitter divorce and lost custody of his children. He had been drinking and staying out till late to cope. You drove him home late last night after the bartender, who was a mutual friend, called you because your friend was extremely drunk and getting into fights. This morning, you see him prepping to perform a surgery. You are worried that your friend is not mentally and physically capable to perform the surgery. Speak with your friend regarding the situation. Now, what you have to do here is that this is your friend who is a surgeon, a fellow surgeon probably, and you've been informed by the bartender. You went to pick him up actually, and he has been drinking and getting into fights and has suffered a really big loss, a bitter divorce and actually losing the custody of his children. So the first thing you're going to do over here is you're going to make sure that you start talking with him as a friend and not as an authority to question him, right? And then you eventually go on and tell him that, how is he feeling, should he take the day off and go and spend some time with you. And if he starts insisting on doing the surgery, you do not directly confront him about his situation. You try to go from another route. You may say that there are nurses and junior doctors in the OR, and they will see that your situation is not right and the surgery is really important to you, and you should really push it away or postpone it because there's a life on your hands and you cannot really mess it up. And then you can even say, Kizi, if they were like your children, what would you expect the doctor to do the same, or would you be okay if their doctor did the same with your children? So is तरीके से you have to counsel them, brainwash them, or more like brainstorm them and try to make them understand that this is not the right time to do a surgery, right? Moving on towards the third case. Your 17 years old patient was recently diagnosed with diabetes mellitus. You have called him to your office to tell him the results. To simplify, as the treatment he needs insulin for the rest of his life. So this is a relatively simple scenario where you have a patient who's 17 years old and you've called them in your office or in the hospital, and you're going to tell them that they have diabetes, which they did not know. And you're going to tell them that they only need insulin for the rest of their life, but you need to assure them that it's not a big deal and it can be managed. Because once you tell someone they have diabetes, which is a lifelong disease, they might panic. Most probably they will, right? So here's how you're going to tackle this case. When you talk to the patient, you first have to make sure that since they are 17 years old, you need to affirm or ask them if they need or want to have an elder with them, because you're going to share some important news, right? And if you feel that no, they don't need an elder, you can definitely tell them the news themselves. They can take it, right? So you go on and you tell them that you've got the test results, and since they had such and such symptoms, it was rather likely that they had been suffering from a disease, and after the test results you have confirmed that they're suffering from diabetes mellitus, right? And then they'll go into a little shock and they'll probably say that I'm 17 years old and I'm really fit and I do a lot of sports and I don't eat like sweet food and stuff and all that, and you have to manage that. And you'll tell them that it's rather about the body's capacity to handle it, and sometimes it's in your genes, and it doesn't really matter if you're healthy or not, because it can really happen to a lot of people. It does have less odds of happening to fit people, but it does happen, right? And then you need to assure them that it's not a big deal, it doesn't really affect their lives a lot. The first few weeks might be difficult, where they'll have to follow adjust to a strict diet plan and insulin and all that, but eventually they'll continue with their life and nothing really has to change. They might say that my life has stopped, what will I do? I want to go on trips with my friends, I want to hang out with them, I want to go on parties, I want to drink, I want to do a lot of stuff. And when they say that, you need to tell them that okay, there have to be a little restriction, but really your life hasn't ended and you have a lot in your life to actually aim for and go for. Okay, moving on towards the next case. A 16-year-old female comes to your clinic with abdominal pain. After your review, you discover that the patient is pregnant. The patient has arrived to your room and her mother is sitting in the waiting area. Okay, this is an interesting scenario because this is a scenario where students most likely get it wrong, right? So if the mother is waiting in the waiting area and the patient is above 16, if the patient is like 16 to 18, they really do not need a guardian to be present with them or to know that if their daughter is pregnant or not, right? Agar 16 say if the age is like less than 16, then it is necessary to some extent. In some states it is, in some states it's really not. Now if you go into the room, here's what most likely will happen. They'll ask you why they have abdominal pain. When you tell them that they're pregnant, they'll probably freak out. So you need to make sure that you give your proper introduction, and then you tell them how they were feeling abdominal pain and how you tested her and how the reports came out. And there's no need to ask her about her sexual life or about if she has interacted with boys or not. Essentially, this scenario is just you need to tell her that she's pregnant, and you need to, she might make a decision to abort, or she might not want to keep that pregnancy, right? So whatever happens, you have to comply with whatever decision she makes, right? But you may want to encourage her to tell their mother, or you may say that eventually all the symptoms that you'll have, your mother will know, and you might want to tell her yourself. But if she wants to remove the pregnancy, you have to comply with her decision. So yeah, that is essentially it. Next case. A night nurse calls you in the on-call room and tells you that she accidentally gave a medication to the wrong patient. The patient is doing well. You go to the floor to speak with the nurse regarding the situation. So what has happened here is that a night nurse called you and mistakenly she gave a particular medicine to the wrong patient, right? Now what has happened is that she'll call you and she'll probably say that, I'm really sorry, this happened, I wanted to tell you, but please don't tell the authorities, and especially please don't tell the patient. The thing is that it is absolutely necessary for the patient to know if any wrong drug or any other drug has gone into their system, because it's their right to know. And then telling the authorities is your duty as a doctor. So if this nurse says that, the drug isn't really that harmful, it was just like a painkiller or so, and we can just add another prescription for the right patient and we can give the drug to them as well, and no one needs to know and all that. So you need to assure the nurse that mistakes happen and it is okay, but what's important is to tell the right authorities, and you're glad that the nurse reached out to you. You'll have to inform the authority of the hospital, but you'll also have to tell the patient, because you administered a drug on their body and it's their right to know, right? So that's how it's going to play out, and you need to make sure that you handle it really well. Next case. Your college has assigned a trip to the northern areas and you are really eager to go. Your performance in the college has not been good and your father has disallowed any outings. All your friends are going and you are really desperate to go. Your father is sitting inside. Go and convince him to let you go. So this is a relatively interesting scenario, because obviously you want to go on the trip. You cannot say no because you have to, and your dad is not allowing you to go on that trip. Okay, and the very reason is stated that your grades have not been good and your performance in college has not been good, right? So once you go in, you have to try your best to convince your father. You have to take on arguments like, it's really important for my mental health and I really need to get away from the burnout I'm having. I need to distract myself a little so that I get more refreshed up and energized to come back and study properly and, get better grades. You may need to make promises to, be better in the future. But if you feel like the father is actually not agreeing to any of the arguments you've made, then it is a possibility that you may agree with the father and actually, comply with his decision of not going on the trip. That's absolutely possible. So it's not necessary that you waste all your time in trying to convince the father and at the end you've really not reached any conclusion. And that's the worst case scenario, right? Next case. A 3-year-old boy has come with his mother for a follow-up visit. He has asthma and was recently intubated, placed on a ventilator during an asthma exacerbation. On allergy testing, he is found to be allergic to cats and dogs, among other things. They own a dog. You suspect that the boy's asthma exacerbation was caused by his exposure to the family dog. In your opinion, the dog has to go. Discuss and convince the mother to let go of the dog. So this is a scenario where you have to talk to the mother and you have to explain to her that the dog that they're keeping has really affected her son's health, and the dog has to go somewhere else, somewhere other than the home. She might, argue that let's keep the dog in another room and, let's, minimize their interaction. Let's minimize the interaction of the dog with her son and all that. She'll give a lot of arguments. She'll say that the dog is like her own child. The dog even came before her own son did and she cannot let go of the dog. You actually have to convince her that the dog would be fine with a friend or with a relative or with a neighbor maybe, and she can go over and meet the dog and feed him and do all that stuff. Even if the dog is really attached to her, she needs to let the dog go. And it's really important for the son's health, because if her son is an asthma patient and has already been exacerbated once, he is not going to go through another such episode. It's very likely that the son will lose his life. So you need to make that very clear to the mother. And if you feel like the mother is not gonna let go of the dog, then you might have to report her, and you can tell her that if you don't make a good decision right now, we might have to report you, because for us, the health of our patient is really important, right? That is how you're gonna handle it. Okay, next case. A 21-year-old female comes to your office for physical. You note that the patient is overweight. Her mother is diabetic and her father is hypertensive. The patient leads a sedentary lifestyle and makes very unhealthy food choices. You worry about the long-term effects of obesity on her health. Discuss with the patient your concerns and encourage her to lose weight. Okay, this scenario requires you to be very non-judgmental yet very concerned and caring for your patient. So when the lady comes in, who is a 21-year-old female, you need to make her understand and give her a sign that you are not judging her. You're gonna tell what you have to for her own health benefits. So you're gonna go on and tell her that, we have noticed this increase in your weight, and sometimes you really need to have to control on your food choices and make good choices, and increase physical activity in your life. You may want to ask her what physical activity she has, and she'll tell you that I go on a walk once a week or twice a week, and you'll encourage her to increase whatever physical activity she's going on. So that's essentially somehow you'll connect with the patient well. Then she'll tell you that she's fine, she's all good, she has a normal weight, and sometimes she goes and eats out. So you need to ask her what does her food routine look like, right? And then she'll tell you that she eats fast food and stuff and all that, and you'll tell her that it's okay to have fast food once in a while, but why don't you try eating vegetables and fruits and meat and cook at home, because that's a way where you technically eat less calories. Then you may want to explain her the whole calories in and calories out thing, eating less calories and burning more. That's how she might eventually have a weight loss. And you can actually tell her that she can calculate her BMI and see what is the ideal weight for her, so that she can aim for that and eventually attain a healthy lifestyle. Thank you so much everyone. That was it for this video. Thank you for tuning in. I hope that you took something out of this video. And as always, I'll see you in the next video. Thank you so much. Allah Hafiz.